So I want to take you through a typical 2-day stay in our hospital. As I stated before, you will see your physical therapist on the day of surgery, but I want to start after your first night in the hospital, waking up the next morning. You're going to continue to have a nurse that follows you very closely almost every hour to monitor your pain control. Remember, that's your nurse's main job, and they're great educators and they're great at helping you monitor your pain control. You're also going to see physical therapy on post-op day 1 at least twice a day. So that means we're going to see you around breakfast time, we're going to have you up and moving around, and then also we're going to see you around lunchtime or early afternoon. The great thing about our hospital is that there is no limit to what we can do as far as physical therapy. If we think you need more work in different areas, we can see you more than twice a day. But twice a day is the minimum that you will be seen by your physical therapist. And some of the things we're working on is transfer training, ambulating in the hallway, exercises. All of these things that we've talked about previously, we're going to continue to work on to prepare you for your discharge home. Also on post-op day 1, if you had a catheter or if you had drains in, those will come out and you'll be able to put your own clothes on. Your IV will be disconnected and you'll feel a lot better getting out of that hospital gown. On post-op day 2, what we're basically doing is fine-tuning a lot of things. Your nurses are going over what kind of pain medications you're going to take home. Physical therapy is working with you on different things that you need some extra help on. And your doctor is coming in and probably discharging you on this day. One of the most important things I can tell you is that we strongly recommend you to have somebody at home when you discharge from the hospital. You're still going to be tired. Your body is still recovering from a major surgery. We don't want you to try to jump back in and do all of your daily activities that you were doing before surgery. At this time, there's a few different things that are very important for your recovery. First of all, your exercises. We've talked about them briefly during these segments, and we're going to talk about them a lot more while you're in the hospital. Another thing is eating healthy. Eating a healthy diet is vital to helping you recover from a surgery. Fresh fruits and vegetables are very important. Before you leave the hospital, your nurse will go over your daily medication schedule. They'll also give you a handout, something that you can see to keep you on schedule as far as taking your pain medications. Most of our patients will go home with what we call home health care. This is where a nurse and a therapist, or one or the other, will come to your house and kind of serve as a go-between from the time when you leave the hospital to the time when you see your doctor for the first time. That therapist or that nurse can check your incision site. They can also go over exercises. They can make sure that you're following your doctor's protocol until you actually see your doctor for the first time.